Good morning, afternoon, or evening. Welcome to the Gender and Digital Health webinar series, which is a platform to foster new partnerships and co-create knowledge on the gender dimensions of digital technologies for health, with a focus on translation of evidence to policy and practice-based learning in low and middle-income countries. This series are organized by a consortium between the United Nations University, the International Institute for Global Health, the University of Cape Town, and BBC Media Action. The webinar today is on gender and phone surveys, methodological considerations. And if this webinar series have been ongoing since January, so we have monthly webinars with different topics. So we had webinars on the digital gender gap, on digital literacy, on big data. So you can still see all these webinars in our website, thegenderhealthhub.org, or in our YouTube channel, whose web link is in this slide. So you are free, and we invite you to live tweet your thoughts, comments, on reflections. Please use the hashtag GHHTalks and Gender Digital Health. And feel free to introduce yourself and ask questions in the chat, or use the functionality of Q&A if you want to ask questions to be answered later during the discussion. So we have here all the webinars that we have done so far and the ones that we are planning to do until the end of the year, and with a special attention to two workshops that are going to happen in November and December. The workshop in November is a deep dive into designing process evaluations with a gender lens for digital health solutions. If you register for these webinars once, you will receive emails with the updates and inviting you to the upcoming webinars and also to the workshops. So today, at the session outline, we will start with the introduction by Amnesty Lefebvre and Sunita Krishnan. And then we have presentations by all our panelists. So we have 5 presentations today, and that will be followed by a discussion based on the questions that we hope that you will put in the Q&A functionality in the chat. So the discussion will be around 30 minutes. So please introduce yourselves in the discussion forum and when you ask your questions. So in the webinar organizers is 4 of us from UNU IIGH, BBC Media Action, and University of Cape Town. And today, the moderator will be Amnesty Lefebvre, who is associate professor at University of Cape Town, who specializes in the evaluation of digital health solutions in low and middle income countries. Dr. Lefebvre has nearly 2 decades of experience conducting mixed methods evaluations of reproductive, maternal, newborn, and child health programs, including digital health solutions in a range of countries in Asia and Africa. Most recently, she has helmed teams assessing the reach and impact of large-scale maternal mobile messaging programs in India, Ghana, and South Africa. So the floor is yours, Amnesty. Thank you.
Thank you so much, and thank you to all of you that are out there joining us live, and hopefully will as well to those of you that are listening to this after the fact. We're so grateful to be here with such an esteemed moderator and Dr. Sunita Krishna, who I'll formally introduce in a few moments, and an esteemed array of panelists whom she'll introduce to you throughout the next 90 minutes. Can you advance the slides for me, Claudia? For those of you that are kind of joining us for the first time for this series, as Claudia mentioned, we've spent the last 6 or so months diving into different topical areas. The impetus for today's session on methodological considerations for phone surveys for women really came about in part out of recognition of the fact that COVID-19 has accelerated the use of phone surveys in health and development research. And on this slide, we wanted to just kind of start with a few slides on the broader context. And so this slide sort of asks the question, why phone surveys? And so you'll see on the slide sort of 2 pictorials, and I apologize that they're slightly outdated. Unfortunately, we can't get an updated version of this, or I haven't been able to find one. So if you find one, tell me. But what you'll see is basically mobile phone coverage for the continent of Africa from 1999 on the left, and just sort of under 10 years later, you'll see the same image for 2008 on the right. And I realize, again, these data are out of date, but they nevertheless underscore the point that mobile phone penetration has increased exponentially globally. Here in South Africa, where I'm based, the Pew Survey Research Center estimates that 95% of South Africans have access to a mobile phone, and 92% own their own phone. That's pretty remarkable. And while we've talked in prior sessions about gender disparities, and we'll come to that, but I think it's with this sort of backdrop in mind of widespread population level access to phones that we're seeing the increased use of phones as a modality to measure health and development outcomes. And as I mentioned, COVID-19 has really sort of accelerated this move. And you'll hear today from many of our speakers about their work on phone surveys under the pandemic. In brief, though, it's worth noting that phone surveys offer a number of advantages over face-to-face surveys. They tend to be lower cost, and they can be a rapid means of data capture. They can additionally offer some degree of anonymity to beneficiaries, as well as flexibility in terms of the timing at which to complete the surveys, et cetera. Next slide for me, Claudia. Despite that, and I think you'll hear from a number of our speakers today, a number of common challenges as they share their experiences trying to overcome these. So in this slide, we've sought to highlight a few, which we'll again have the occasion to dive more deeply into throughout the next 90 minutes. But first is really this challenge of reaching women. In several prior webinars, we've discussed the disparities not only in women's access to phones, but too in the digital skills and other factors that underpin their ability to use the phone. I'd encourage those new to our webinar series to again check out the session on digital literacy, which talks a little bit about this, and an earlier session on the digital gender gap. And hopefully Vitya will paste these in the link for me, and you can also reference the earlier slide with the YouTube channel and the UNU webinar link that Claudia kindly mentioned. Linked to this challenge of reaching women is the overarching sampling frame from which the phone numbers are taken. How were these numbers obtained? Was it through a face-to-face contact with a health worker? Was it through a mobile network operator? So how complete and accurate are these data given the frequency of SIM change? So there are a number of factors there to consider. A central challenge also lies in establishing the identity of the respondents, particularly in settings where physical addresses might not be available and SIM cards may be purchased by husbands or other male family members. Lastly, phone surveys often are much shorter, and as a result, the kinds of data we can capture may be more limited. Next slide. So in this slide, and for those of you that are not new to phone surveys, you'll be very familiar with all of these, so apologies for the redundancy, but we wanted to briefly give you an overview of some of the kinds of technologies you may hear about, which are currently in use for phone surveys. So in brief, phone surveys can be done through voice calls, using a computer or technology-assisted interview. So this is where you might get a respondent that calls you up on the phone and walks you through a standardized questionnaire or qualitative interview that they're then typing the responses to on a phone or using a software. They can also occur through text messages, using interactive voice response calls. So that's essentially when a computer application sends an audio message to your phone. And lastly, through USSD. So for those of you which may be unfamiliar with that modality, it's most commonly used when you want to purchase a prepaid voucher to top up your phone numbers. It's that *125* and then the PIN number you enter in. That's a USSD channel. So again, if you're unfamiliar with some of these or have questions about it, just type it in the chat and we'll seek to answer it as we go on. But for the sake of today's presentations, most of our speakers are going to be talking about IVR and CADI surveys. Next slide, please. So in these next few slides, I'm going to do a whirlwind tour of some of the cross-cutting methodological considerations which are going to come up today in greater depth. You'll see from the red horizontal bar, we sought to conceptualize the steps for developing, implementing, analyzing, and presenting phone survey results in a linear fashion. Of course, it may not always happen in a linear fashion, but bear with the simplicity. So on the far left, we start by emphasizing the need for you to consider your sampling frame and participant recruitment. So you need to define what you want to measure, look at the phone access and use characteristics of the target population, identify a source for your sampling data, beware of the issues around the data quality and completeness, and then develop a recruitment strategy. Next slide, please. Once you get to the stage of developing a tool and refining it, there are lots of different ways to go about this. Often people will start with a review of the literature, including sort of data collection tools that are available through face-to-face surveys like MIX or DHS. And then they'll sort of seek to define construct in the measurement format, including response options used and so on. You might get expert judgment. And then you'll go through a process once you have a draft of the tool of translation and retranslation as needed. You might do cognitive interviewing, and we've had prior sessions on that as well. Then piloting and reliability testing. Again, you'll see huge variability in how folks approach this part of the development process. Next slide. And then around the implementation, and our speakers are really going to talk a lot about this today. You might hear a lot about issues around the enumerator profile and recruitment. Differences in the implementation protocol. So this can be everything from the retries, the number of times you call somebody to get them on the phone, the time of the day at which the calls are coming, the incentive structures folks are using, quality control and assurance procedures, and then, a lot around ethics and consent and privacy. And you'll hear from Karima and Priya a little bit later about that. And then, of course, what protocols you might have for referring or mitigating respondent risks. And then around our last two steps, next slide for me, in terms of analysis, you might want to consider, the response and completion rates by sociodemographic characteristics to kind of understand the implications this may have on your generalizability, whether or not weighting is needed to adjust for that. And then, in terms of the reporting, you may have to do it increasingly at different levels. So one of the benefits of phone surveys is technically we should be able to quite easily feed back those summary results all the way back down to the beneficiary level. But for a variety of reasons, we often don't see that happen. So next slide. So with these sort of in the back of your mind, grounding our discussion today, I'm really, really pleased to introduce our moderator, who's going to introduce our panelists and take us through today's session. So Dr. Sunita Krishna is the Deputy Director for Strategy, Planning, Management, and Evaluation at the Gates Foundation's India Country Office. She's a social epidemiologist by training and currently responsible for strategic and financial planning, operational activities, measurement, learning, and evaluation at the India Country Office at the Gates Foundation. Over the past 4 years, she's supported teams to use complex adaptive systems thinking to improve program design and evaluation. She's established partnerships to enhance research and evaluation capacities in India and led the development of internal processes to promote a culture of learning and adaptation. On a personal note, she's been extremely supportive of our research teams for digital health in India and been a real pioneer in this space in India. So without further ado, we're thrilled to have you, Sunita. The floor is yours.
Thanks so much, Steve. The pioneers, you and everybody else on this panel. I'm just a person in the background. As you mentioned, Amnesty, there's been quite a lot of innovation in social science research over the past year and a half. This has been necessitated by lockdowns and the risks associated with travel and in-person interviewing in post-lockdown settings, and also driven by a need for rapid insights on the ongoing crisis to inform policy and programmatic decisions. And this has resulted in the emergence of a variety of phone survey methodologies. And these innovations in the context of the pandemic form the backdrop for much of the work that we're going to be hearing about today. Accompanying these innovations are a range of challenges and dilemmas that need to be navigated. And Amnesty, you've alluded to several of them. I've had the privilege of engaging with the research community of practice focused on tracking the impact of COVID-19 on lives and livelihoods, including specifically on women in India, over the past 18 months. And in fact, two of the groups on the panel today were members of this community called CoreNet. Members of this community seized on phone surveys as a rapid data generation tool. And at the same time, they acknowledged and grappled with a range of questions. What happens to the relationship between researchers and research participants in the context of phone surveys? How is this relationship affected by gender dynamics? What are the implications for data quality? Researchers also discussed and debated ethical issues. What specific risks emerge when conducting surveys over telephones or mobile phones with women? What obligations do researchers have when gathering data during a crisis and that raises ethical and methodological questions. How can privacy and confidentiality be protected? And what are the implications for how research teams are constituted, trained, supported, and supervised? So today we're going to be gaining insights into a number of these questions and more. We have a mix of experiences, groups that have turned to phone surveys more recently in the context of the pandemic, and organizations that have been using IVR and other methods more routinely. So with that introduction and framing, let me move to the next slide and introduce our first speaker, who is Divya Nair, who Director at ID Insight. Divya is someone who's worked effectively with governments, multilaterals, and NGOs for almost 15 years. She leads teams to identify key challenges, design and execute high-quality, demand-driven analytical services so that clients can improve their process evaluations, monitoring systems, et cetera, and improve their social impact. She's deeply invested in addressing topics around health and nutrition, and particularly among women and girls, and has worked on financial inclusion, sanitation, agriculture, as well as health. Divya has a PhD in public health and economics from Johns Hopkins. So over to you, Divya.
Great, thanks a lot, Sunita and Amnesty. It's a pleasure to be here. I've actually, can you just move the next slide, please? I'll just start with an introduction to ID Insight before jumping in. ID Insight is an organization that works with governments, non-governmental organizations, and funders. And our goal is, to support evidence-based decision-making. We tend to, focus on social impact, and the way that we measure ourselves is often in terms of better decisions made based on evidence and data. Next slide, please. So just talking a little bit more about what this means is, as I said, we are focused on impact. We measure ourselves by the lives we hope to improve. And we are flexible, we are agnostic in terms of the tools we use. So we use tools from qualitative analysis to machine learning and conducting randomized control trials, etc. And we also like to challenge the status quo. By that, what I mean is, we develop cutting edge tools. So I'll talk a little bit about the data on demand innovation that we applied for in this context, where we have surveyors across India who we manage, train, and Amnesty just showed the flow chart in the way of the various steps that are required to collect data when using phones, and we do all of those steps, and our data on demand infrastructure kind of supports us in collecting data across India in particular, and we are slowly expanding geographies. Next slide, please. Today I was going to be talking about the COVID surveys that we conducted. The data on demand infrastructure originally was an in-person infrastructure, and we were experimenting actually with Sunita, looking at also collecting data on phones. But the pandemic kind of forced us to really lean into collecting information only via phones. And that kind of pushed us to look at the context in which we were collecting data. And I'm going to give you a little bit of the figures in the Indian context, in the sense that, as you can see, there's a range of estimates in terms of the disparity in mobile phone ownership in India. This number basically says that men own, when they're asked about ownership, the question here is in terms of SIM card ownership. 79% of mobile phone owners 79% of men say they own a phone, whereas compared to 63%. The next slide, please. Whereas if you look at the most recent NFHS data that was collected in 2019-2020, and that was for a subset of the states in India. When the question is asked at the household level, as Amnesty mentioned, the numbers are very high. So, 90% plus of households are saying that, across these 3 states where we collected data, are saying that they have access to mobile phones. But when you ask the woman, do you have a mobile phone that you use, then the numbers really change. And that's the challenge that I think I really want to highlight in terms of the access to phones, especially when you're calling using a phone survey. Next slide, please. So over 2021, we conducted 8 phone surveys. These were large household surveys across India. All of these were actively targeting women, but some were more so. 5 of these surveys were a mix. So they were looking at both men and women, whereas 3 of them, it was focused exclusively on women. So we were collecting women on targeting women, especially pregnant and lactating women, because we were working on Poshan Abhiyan, which is the National Nutrition Mission in India. We also targeted self-help groups, female entrepreneurs who were part of self-help groups. And the topics we covered included knowledge, attitudes, and practices related to COVID, women's digital access, and also, as I said, experience of women as part of self-help groups. So it was a whole range of topics, including employment, access to labor markets, etc. Next slide. So as I mentioned, the fact that very few women have access to a phone means that when we randomly call a household, we found, and in terms of methodology, very often the metadata that is being collected, or when you're using phone surveys, is not analyzed. So we've recently written an article which is being published in the British Medical Journal, where we looked at some of the metadata across these 8 phone surveys. And from that, we had, and it was a learning for us also in terms of improving the kind of metadata that we do record. But from 2 of our phone surveys, what we found is that when we randomly call a household, 60 to 70% of the time, a male picks up the phone. And can you just press once more? And regardless of whether the man or woman picks up the phone, only 10% of the time is a person willing to pass the phone on to another person of a different gender. So what this means is that men often become the gatekeeper when you randomly call the household, and therefore for some of our original household surveys, our response rate for females was just 20 to 40%. Next slide. Kind of digging deeper a little bit in terms of access, we also found that within a household, when we did ask about access, 3/4 of within the same household, it was men who said that they use the phone daily, and women, on the other hand, only around 50% of them said that they use the phone daily. And this was within the same household. So we're controlling for socioeconomic status, etc. And 1/3 of women said that they were using it only for emergencies. We also actually looked at number of phones within the household. And even 1 and 2 phone households, there was a very big difference in terms of use of phones and access to phones. Next slide. So I'm going to skip over this a little bit, but just to give you a sense of the evolution in our thinking, is that initially what I was describing was this light touch gender targeting, where we would actually assign households to be male or female households. And we would call to get that target respondent on the phone. And if we didn't, then we would proceed with the interview. And that's when our response rate in terms of women was very low. It was 20 to 30%. what happened over time is that we realized that, especially, for example, when we wanted both men and women from the same household, is making an appointment and then calling back to talk to the woman helped a lot. And our response rates increased tremendously. Similarly, basically, sorry, can you keep moving? I'm just going to rush a little bit because so our target, our target response rate increased to around 43%. So we doubled because we had these appointments, and that was because basically what we found is that women are not available, on call. They don't have access to the phone, and very often the man takes the phone with them to their workplace, etc. So the woman doesn't have access. Can you please move next slide? So what are the ways in which you can increase access to women's voices? One is having female surveyors. We found that having female surveyors really increased our reach and a consent to answer, to respond. Next slide, I'll talk a little bit more about this. So, building trust is very important when you're calling and speaking to a woman. And there are various ways of doing that. I'm sure other panelists are also going to talk about that. And this is true whether it's a man or a woman. But women in general were able to kind of, our hypothesis is that the women were able to kind of cross some of these cultural barriers better in India in terms of being able to build that trust. Next slide. So I just wanted to put this out there. This was our way of thinking about getting women on the phone. There are these structural and normative barriers that kind of prevent women from often, being fully, all their voices being reflected. And I was thinking that this, could be useful in terms of the research agenda, in terms of each of these parts needs to be addressed. What we have published or really looked into is where we have the data, but in many cases, a lot of these pieces have not been tested. And so, in terms of like future, in terms of going forward, there's a variety of ways of improving the voice that we represent. And, I would encourage the community to kind of look at various aspects of this. And next slide. My last slide, I just want to make a few points that are pulling from the previous slide. So context of respondents really matters. Apart from women, we've learned a lot in terms of like agricultural labor, female labor is, for example, the kinds of questions that you ask them. Basically, we did actually do some testing where we saw that when you ask the woman a question as compared to a man, you would get different responses. And there have been, there have been other papers talking about this, but it's important in terms of whose voice is being represented by your respondent. So whether the question is for the whether you're asking a question about the woman or you're asking a question about the household, it's useful to be clear about that. And going back to what I was saying in terms of timing of call, the time that women are available is different from when a man is available. So when you do call back, you want to make sure that it's a convenient time for the targeted population that you're looking at. In terms of privacy, I think, and ethics, I'm assuming other people will touch upon it. I wanted to reiterate, as Amnesty had said, that keeping the questionnaire short is very important on the phone surveys, and that means that you have to be careful in terms of the kinds of questions you can ask. We've also done some qualitative work on phone surveys. So, you can be innovative and creative, but you have to be careful in terms of, what your expectations are, because people can't see the context often of the respondent. And finally, before, and I just want to give you a number, is that in terms of non-response, we were basically talking to men and women who we had often already interviewed in person. So that's why we had people's phone numbers, and that's why we were able to kind of access them. They also had more trust in terms of they had, talked to us in the past. And our non-response at that time in person was around 6%. when we called on the phone, our non-response jumped to 57%. And that's something to keep in mind, is that, and then the kinds of households who we lose are often the poorer households and particular types of households. So keep in mind that you have to kind of make that extra effort to get those households that you lose when you change mode from in-person to phone. And finally, just a plug to try to share insights with the people whose data you're collecting. I think that would be great if we could have a discussion about that at some point. Thank you.
Great, thanks so much, Divya. A lot embedded in your slides. We'll come back and dig a little bit further into, issues around content and ethics, as well as get into the discussion. So let me move on to the next panelist. And so the lead presenter for this is Karima Khalil, who's an Egyptian Swedish public health physician with 20 years of experience doing research. Karima led the reproductive health research program at the Population Council's West Asia and North Africa Regional Office in Cairo for 10 years, and currently is a senior consultant with Oxford Policy Management in Delhi. Karima is presenting on behalf of herself and Dr. Priya Das, who has over 20 years of experience working on policy and research in the development sector, and Priya is a social anthropologist. So Priya and Karima are going to be speaking specifically to the ethical considerations of phone-based interviews based on what they've done in Bihar, India. Over to you, Karima. Karima, you have to unmute.
One never learns. Okay. Thank you, Sudita. And thank you, everybody at the University of Cape Town and BBC Media Action and the Gender and Health Hub at UNU for facilitating this and for inviting us to be part of this webinar. It's a great pleasure. Thank you very much. Next slide, please. So I think I'm going to skip this slide because both Amnesty and Divya have mentioned this. So next slide, please. So I'm going to talk about examples of some of the challenges, both conceptual and practical challenges that we faced in conducting 3 studies of COVID-19 impact in Bihar, which is in eastern India. And in addition to presenting these challenges, we're going to present some of the positive implications that we came across with and unexpected advantages of the shift to digital data collection, with a couple of recommendations for future phone-based research in low resource settings. Next slide, please. So I'm going to talk about our experience in 3 studies. I'm going to try to be very, very quick. We did 2 facility-based provider studies where we interviewed providers at primary healthcare facilities in Bihar. The first was a facility ethnography study that had been an in-person study, and then when the pandemic happened, it shifted to a phone-based data collection platform. The second study was a specially designed longitudinal phone survey of about 150 primary level health providers, again at the primary level. And this we call the COVID-19 provider study, and we collected data over 4 different points in time. The 4th round of data collection was about 6 weeks ago. The third study was a community-based study, and that was a qualitative study of women's perceptions and their experiences of COVID-19. And that we call the COVID-19 in rural Bihar experiences of community women study. The takeaways that I'm going to be sharing with you today are from these 3 studies. Next slide, please. So I think both Amnesty and Divya have mentioned several challenges, and I think they're going to be, many of them are common to all of the presenters who are going to be speaking today. I'm just going to read out these bullets here, and then I'm going to go into some of them in greater depth. So research relevance, how necessary is it for you as a researcher or as a research team to conduct this study or to do data collection at this point in time under pandemic conditions? Inclusivity and representativeness, I think Divya mentioned that quite comprehensively. How do you get consent to actually contact people? Informed consent to participate was another challenge we faced. Time burdens, building trust, privacy, and confidentiality. Next slide, please. Data quality, distress redressal, and data security and interviewer privacy. So these were all main challenges that we faced, and I'll talk about a few of them now in greater depth. Next slide, please. Next slide, please. So what about inclusivity and representativeness? I think Divya went into, illustrated really very nicely the challenges that we face in LMICs, in how we can miss the most vulnerable segments of our populations, who may be women and who may not own phones or have access to them. And I think all her slides illustrated this beautifully, so I won't go into a great detail here to avoid repetition. But clearly this has implications for sampling representativeness and the relevance of our findings. And this was a challenge that we tried to mitigate, but we could not mitigate fully. And I'll discuss in a few more slides how we tried to go about this, but we could not mitigate it fully. Next slide, please. What about initiating contact and having consent to initiate contact? So accessing telephone numbers and acquiring consent to contact people has to be done carefully so as not to invade people's privacy and to avoid the potential for coercion. So in the facility ethnography study, the facility providers, the nurses and the doctors and the managers and the medical officers who we interviewed had initially given their consent to be contacted by phone at the very beginning of our fieldwork with them, at the very beginning of our ethnography, i.e. when we were still when our teams were still in the field interviewing people face to face, they had given their consent to be contacted by phone. And we did, in fact, sometimes contact them by phone in parallel while we were doing the face-to-face data collection. Then, of course, with the advent of the pandemic, the data collection shifted to being completely phone-based. Next slide, please. In the COVID-19 provider study, the phone numbers were accessed from the State Health Society directory, and we sent an opt-out SMS before telephoning. We also had letters sent via the district administration, who were the body that was superior to the primary healthcare providers, to inform them that the study was taking place. In the community women's study, contacts were accessed through a development partner, Jivika, and the women's consent to be contacted by us was recorded. Their consent to be interviewed by us at a later point. Next slide, please. So time burdens was something that we were very mindful of across all three studies. The interviews, as Divya pointed out, are always better if they're done to respondents' convenience. And these were done over 2 or 3 calls if the respondents preferred. So if they preferred that they would be called in the evening, we would do so. In the afternoon, we would do so. If they had to cut short a call and be called back later, we would do that as well, to be mindful of the time burden on them. The COVID-19 provider study, where we telephoned doctors and nurses repeatedly over 4 rounds of data collection, we would remove questions that we'd asked in previous rounds in order to add questions, new questions in subsequent rounds, and so we could keep the tool as short and as efficient as possible and to stay within time limits. The community women's study took a different approach, and they adapted the interviews, focusing on the issues that the respondents wanted to speak more about. So if the respondent spoke at length about a certain topic, then the interviewer would pivot or shift and go into a deeper dive on those points, instead of just going through a pre-prepared checklist comprehensively. Next slide, please.
Karima, just to give you a warning, you're at 7 minutes. Sorry.
Oh dear. Okay. We put a lot of effort in rapport building. The interviews are trained to be patient and empathetic, and all researchers were coached in active listening and maintaining affirmative inquiry. Next slide, please. Privacy and confidentiality was a very important issue. There were 2 vulnerable groups that we were surveying: providers who could perhaps be put themselves at risk if they criticized the facility they were working in, if they were interviewed on the spot, and community women whose responses could potentially reflect negatively on the program they were part of. So therefore, all respondents were asked when would be a good time for them to be called back, when it would be when privacy could be ensured. Next slide, please. As we heard from Divya also, sharing sensitive information can put respondents at risk, even in home settings. So this means that you have to be sensitive to language. Domestic violence, for example, which has risen globally, is important to capture. But it's also important to guarantee that respondents aren't overheard by a family member who might be perpetuating that violence. Next slide, please. So the community women study avoided directly questioning people on violence, women on violence. So instead, questions were used like, how have the dynamics in the household changed? Have stress and tension increased, and why? These were proxy questions instead of asking directly about violence. Thank you. Next slide, please. One challenge that the interviewers faced was that respondents sometimes were stressed and asked for solutions relating to the pandemic, like were they entitled to any remunerations from the government for the pandemic, for example, or they're fearful about their husband's safety. And some researchers felt an ethical dilemma not being able to provide actual concrete support to the respondents. Next slide, please. So we faced some unexpected advantages. Next slide, please. I'll try to rush through these as quickly as possible for interest of time. So the first point we've heard before, it allowed critical research when face-to-face data collection was impossible. For facility providers in health units, the privacy of the phone interview encouraged them to be very open about challenges that they faced. Doing an interview at respondents' convenience was another big advantage, and splitting the interview over several calls was also very helpful. Next slide, please. The phone platform provided anonymity to women who perhaps felt more comfortable to share their experiences. We also felt that the lockdown meant that women were quite socially isolated and were unable to meet and share concerns with others. The qualitative phone interviews perhaps provided them with some benefit by creating a space where they could voice their concerns. Also, by recording calls, it was easier to monitor interview quality. Next slide. So, in conclusion, when respondents are familiar with basic technology and they have autonomy and are empowered, remote data collection is very effective, or can be very effective. But where telephone usage is restricted by digital inequalities, particularly across gender, access to subjects will be impeded, as we heard again from Divya, and these may be the most vulnerable subjects. Losses to recruitment will persist for constituencies who are not comfortable with using telephones, for example, where there are only local dialects are spoken or where there's low literacy. Next slide, please. The effectiveness also depends on the subject of study. So researching sensitive topics by telephone, such as domestic violence or sexual and reproductive health concerns in adolescents, will remain challenging. And then for a couple of final slides, please. Next slide, yes. The one very important point I'd like to make is that IRB panels put very short time limits on call duration, sometimes a maximum of 15 minutes. And they have very standardized wordings of consent forms. These need to be more flexible to allow for fuller explanations of consent, to build rapport, and to allow for active listening on digital platforms. Because of the extreme stresses the pandemic is invoking, empathetic surveys of COVID-19 impact require calls of longer duration rather than shorter ones, and longer than are normally allowed. In the words of one of our facility ethnography study team members, to be ethical, we actually need more time, not less. Thank you. And I'm sorry for going over time.
Thank you so much, Karima. Clearly, these presentations are very, very rich. There's so much, so many insights embedded in them. I think it's really interesting to be thinking about as we emerge, at least in some contexts, from sort of this very acute COVID surge, and perhaps as there are opportunities for face-to-face interactions, how do we actually draw on the strengths of phone surveys and sort of use them as part of a diverse toolkit? So let's move to the next panelist, who is Arjun Khanna from the BBC Media Action. Arjun works on the Digital Women's Economic Empowerment Project at BBC Media Action. He brings a diverse academic background as well as strong interest in all things digital and culture to the project. The project explores the intersection of gender digital technology from the lens of women's empowerment collectives in India. And Arjun's going to be speaking about using phone surveys for remote human-centered design during COVID-19. Over to you, Arjun.
Thank you for the introduction, Sunita. Hello, everyone. My name is Arjun, and I work on the Digital UIGH project at BBC Media Action. BBC Media Action is the BBC's international charity. We believe in media and communication for good. We reach more than 100 million people each year in some of the world's poorest and most fragile countries, where our projects and programs save lives, protect livelihoods, challenge prejudice, and build democracy. I'm going to be presenting today on our recent experience of applying a human-centered design process remotely through the use of qualitative and quantitative phone interviews. At the start of the first COVID-19 wave in India, BBC Media Action took the decision to suspend all face-to-face research activities until they could be conducted safely again. As it
Sorry,
did for many,
Arjun, I don't mean
Yeah.
to interrupt you, just 1 second. Claudia, we've lost the visual on the slides. Are you there? Apologies for the tech difficulties.
I think
I'm
she's
worried-
lost. She's dropped.
I think we've lost Claudia, actually.
Yeah, we've lost her.
Okay, okay, no problem. Just give me
Plan
2
B.
seconds to
Yeah.
get you up and running. Let me share screens. Apologies, everybody. We'll get there. Can you see my slides now, Arjun?
Yes, we can.
We can.
Okay, great. My apologies about that. Continue, please.
No problem. At the start of the first COVID-19 wave in India, BBC Media Action took the decision to suspend all face-to-face research activities until they could be conducted safely. As it did for many other organizations, this provided various challenges for us. All the research plans that we had spent months developing were now placed in limbo, and while desk research was unaffected, it's also not sufficient. What was clear to us was that we needed to find a way to adapt in order to continue our work on the project. This brings us to Bharpur Academy. One of the core components of our project is the co-creation and testing of digital solutions with women's empowerment collectives. These collectives were also faced with COVID-related challenges. They were restricted in their ability to conduct regular activities and especially to deliver training. So, in collaboration with SHG supporting organization Pradhan, we began designing the first of our digital solutions, an IVR-based agricultural learning service called Bharpur Academy. Bharpur Academy was envisioned as a 3-part course on best practices related to potato cultivation, delivered entirely remotely to marginalized women farmers in the Banka district of Bihar. There were many design-related questions that we needed to explore, and Bharpur Academy would provide us the opportunity to test and identify approaches that showed promise, which could perhaps be taken up as pilots at a later stage. But we did have to ask ourselves, how are we going to implement our standard human-centered design process, which was all face-to-face, entirely remotely? Next slide, please. So while the internet has played a great role in supporting remote research for some, our particular target population meant that more advanced digital techniques were not an option for us. Low-tech was emerging as our only viable route. CAPI surveys would be changed to CATI, in-person qualitative research would need to take place over the phone, and similarly, many of our processes would be replaced with telephonic counterparts. However, the low transferability of these processes also introduced limitations on what is achievable through remote research. But this limited set of tools could still prove useful for our purposes, which were to perform design research with Bharpur Academy. Next slide, please. So I'm just going to quickly start by covering the research pieces that we implemented before the rollout of Bharpur Academy. We partnered up with Cadence International to implement 2 short CADI surveys at the start to inform the design of the digital learning solution. These surveys would reach marginalized women farmers who are members of SHGs and the husbands of women like them. One important point to note, however, is that the men respondents were not the husbands of the women that we interviewed. We would discover during piloting that interviewing couples had the potential to create conflict, and thus chose the interview respondents from separate households instead. Next slide, please. These quantitative CATI surveys would also be complemented by semi-structured phone interviews, which would allow us to deep dive into areas identified through the quantitative research in much richer detail than quantitative surveys allow. In addition to these studies, we took cues from the practice of cognitive testing, which I believe Amnesty will share a link to at some point, to test the comprehension of key agricultural terms and identify those that were broadly understood to create a dictionary of accessible language. At the same time, our creative team undertook unstructured qualitative interviews with women from participating SHGs to build an understanding of their vocabulary, tonality, mannerisms, and this has all proved critical to designing effective content that is accessible, relatable, and engaging for audiences. Next slide, please. But none of this research would be possible without an existing database of phone numbers to engage with. While Pradhan did have an existing database of information on women in SHGs, this database did not contain any mobile numbers and no information on men. To address this, Pradhan was able to enlist the support of SHG Federation staff, who would use digital data collection tools to collect 3,000 phone numbers from women who had chosen to participate in the proof of concept. This database would then be used to randomly sample respondents for our CATI surveys, and it would eventually also be used to purposively sample a diversity of female respondents for qualitative phone interviews. All research tools needed to include tailored screener sections at the start of every interview in order to ensure that we only interviewed people that met our criteria. Trusting a phone number to refer to a person is not enough. And to provide compensation remotely, we would provide phone talk time credited to a number of the respondents' choice. Next slide, please.
You're at 7 minutes, Arjun.
Sorry, yeah. But this approach does not come without its own challenges. Although we were able to achieve our target of interviews for the first survey, it would require us to make over 6,500 calls over the course of 10 days to reach 300 women. Additionally, more than 60% of the 3,000 numbers would not answer a single call that we made to them. By the time it was time to implement our second survey, which was delayed by 3 months due to COVID-related problems, we found ourselves unable to meet the same targets from the same databases as the first survey. We hypothesized this was due to male migration related to the pandemic. Many women had provided their husbands' phone numbers at the time of data collection, and when the lockdown lifted, many of these men returned to their workplaces in the cities, taking the phones with them. Fortunately, with the support of Pradhan, the SHG federations would do another round of data collection, collecting 1,300 new mobile numbers from the same women and allowing us to meet the targets. The compensation would again prove challenging. While phone talk time is convenient to deliver remotely, there is no reliable way to identify the relevant mobile operator to send the credit on. Respondents would also request credit in the form of packs, which proved difficult to standardize as compensation. Next slide, please. And the next, yeah. This remote research would continue for the entire duration of the project. And once Purpur Academy was live, we were able to make use of system-generated records to monitor usage of the course on a daily basis. It would allow us to identify any trends in uptake or user behavior that warranted investigation. This daily monitoring would also allow us to identify issues with IVR navigation and immediately modify our design. It would also be used to source respondents for further quantitative and qualitative studies. Next slide, please. So we would go back with Cadence once again to conduct 2 more CATI surveys, this time with individuals who had called the Purpur Academy courses. Dividing the targets up based on a mobile number's progress in the course, we would use these surveys to identify differences between these 3 groups and explore their experiences of engaging with the course. Next slide, please. We would also continue to engage with participants over the phone through qualitative research, which would allow us to explore participants' experiences of the course from the very first time they were introduced to it up until its eventual close in early 2021. Next slide, please. I'm now going to present some insights that emerge from the design research, which will go on to inform the design of future solutions that may arise from Bharpur Academy and be piloted with robust evaluations. Through the HCD process, we found that Bharpur Academy was most effective for younger women with at least a primary level education. These women would report much higher levels of understanding of Hindi and the course content in comparison to other respondents, such as older women with no formal education. One of our most interesting findings was the prevalence of shared listening. Over 60% of our sample reported that they listened to the course along with someone else. SHG members, husbands, and children were frequently reported as companions. This suggested to us that IVR learning could be an effective information dissemination tool for an entire household. Women whose mobile phone numbers had successfully completed the course will also report the highest levels of shared listening, while those who could not complete the course or unsuccessfully completed the course would report much lower levels of shared listening, suggesting to us that building in group listening and peer learning is an important design consideration for IVR learning. Unsurprisingly, we also found that women who currently held an office related to the SHG, so a group leader, secretary, or Krishi Sakhi, for example, and respondents who own phones reported higher levels of digital skill than others, displaying a higher ability to engage with IVR learning. One last interesting finding was that the type of phone used by an individual does not correlate with their level of digital skill. Many smartphone users that we would speak to would turn out to be facilitated in their use of smartphones. Next slide, please.
So you're at 11 minutes. Sorry.
Yeah, this is my penultimate slide. Is that all right?
Yeah, go ahead. Please,
sure.
Go ahead.
At the same time, it is important to note that even digital approach, as accessible as IVR learning, is not good enough for all segments of the population. Older women with no formal education display extremely low levels of digital skill. In fact, approximately 20% of our sample of women reported that they could not even dial a phone number without assistance, which is a necessity for IVR learning. These respondents would also report the most difficulty with IVR navigation, often being unsure about how to perform even simple two-option inputs. This segment also prefers speaking in local dialects to Hindi. We observed that some would request another family member to facilitate their engagement with the course. This suggests that the IVR learning designs can be built around facilitation by someone such as an SHG or a family member, functioning as a guide or translator for women who have difficulties. Short outbound messages that only require the user to answer a call then emerged as a lot more effective for this particular segment, suggesting that our approach of timed outbound reminders at crucial points in the agricultural cycle shows promise for future implementation. Next slide, please. Right. As we recently discussed the importance of a good source database and the importance of it being recent, there are very high levels of SIM churn in low resource settings, which creates a significant challenge for any longitudinal remote research in these contexts. Most important, however, and as other speakers have mentioned, is considering whether your target population is reachable over the phone at all. While our respondent groups were consistent with Pradhan's previous face-to-face research on indicators such as age and education, approximately 80% of women respondents would report owning a personal phone. This is much higher than commonly reported figures from face-to-face research. For example, the Kilkari RCT with Johns Hopkins would find that about 40% of their women respondents reported ownership of a phone. This was not a serious problem for our POC, given that our design is based around access to a mobile phone, but it can present a major barrier for design research that aims to be representative of a population. Selecting respondents from phone numbers is not simple either. It is important to remember that one phone number does not always mean one individual. Other challenges would include the difficulty in conducting follow-up interviews due to low response rates, limited control over the interview environment, which often meant that respondents were distracted, and critical to digital interventions, an inability to conduct observed tests to measure digital skills, leaving researchers entirely dependent on self-reported data. Phone interviews also tired respondents much faster than face-to-face interviews do, which sometimes led to incomplete interviews. But this is not to suggest that there's no value in doing phone research. Next slide, please.
So Arjun, I have to really cut you off here at like 13 minutes.
All right.
So maybe just quickly wrap up for us. Sorry.
Yeah.
This is very good content.
Right.
Yeah.
Just to wrap up really quickly, we do essentially need to be realistic about what can and cannot be achieved through this approach. Having a partner organization with local expertise and networks is critical to the remote design process, and we would not have been able to do what we did without support from Pradhan. CADI surveys also need to strictly prioritize what information they collect. because of the limited duration. Using longer batteries of questions, such as questions that establish economic status, comes at the cost of collecting other information. And lastly, but certainly not the least, continuous iterative research activities are the foundation of this design process. The continuous engagement allows us to ensure that we remain flexible and responsive, modifying our design as soon as problems are identified. And this responsiveness is driven by qualitative research, which allows for flexible exploration and is not tied down by the longer time to implement that CADI surveys are tied down by. We cannot stress enough, really, the immense value and importance that qualitative approaches bring to the human-centered design process. And that's the end of my slides. Thank you everyone for listening, and please feel free to keep engaging with us in the chat. Thanks, Amnesty.
Thanks so much, Arjun. Yes, the conduct of phone surveys, particularly with women, clearly, is the details. Lots and lots of details. It'll be important to note that women are not a monolithic group. Let's move right along to the next speaker on our panel, Leah Taub. Leah is the Director of Partnerships, UN agencies at VIAMO. As Director for Partnerships, Leah spearheads strategy to initiate and strengthen relationships with a number of different agencies, UN, World Bank, etc., to drive impact across 28 countries. Leah brings over a decade of experience in cross-sectoral international development and private sector with a focus on information and communication technology for development. And Leah is going to be speaking on methodological considerations, gender and IVR surveys. Over to you, Leah.
Hi, everyone. Thank you so much. Good morning, good afternoon, good evening. For those of you who are not familiar with VIAMO, we are a global mobile technology social enterprise, short for VIA Mobile. We believe that information is power, and in improving lives by providing and gathering critical information via the mobile devices that people already have access to. In 2020, VIAMO, with our partners, engaged over 30 million people across 27 low and middle income countries with messages to improve their lives. Change slide. While VIAMO works across all mobile devices and channels, we specialize in the use of IVR, or interactive voice response technology, which you've heard about from some presenters today. So IVR calls are pre-recorded voice calls in local languages that a caller interacts with using the keypad of his or her phone. The biggest advantages of IVR include overcoming literacy barriers where SMS may not be feasible, higher response rates than SMS, typically 2 times better than SMS depending on the country, reducing interviewer bias such as social desirability or measurement errors, lower cost compared to CADI surveys, and usually faster than face-to-face. It can also be paired with other channels such as SMS reminders and CADI for non-response, and can be supplemented by airtime vouchers or top-ups as an incentive. But this depends on the country and is recommended to be pre-tested because in some cases, not including an incentive has led to higher response rates. Change slide. Overall, IVR surveys are a simple, scalable, and cost-effective way to collect data from your target population, including for baseline end-line research, rapid feedback polls, media monitoring, panel surveys, CAP surveys, and national surveys. Change slide. In terms of features, IVR surveys can be recorded in multiple local languages, be any combination of multiple choice, numeric, and open-ended questions, include advanced features such as randomized answer options and retry patterns, be sent to as little as 100 people and scaled to reach over 1 million people, and be sent to specific groups based on demographics such as gender. IVR can also be tailored in terms of timing, voice, and style to what is most suitable for the audience at hand. So for instance, the time we send an IVR survey to a woman might differ from the time we send the same survey to a man. Change slide. In terms of trade-offs of IVR surveys compared to CADI and face-to-face, even though we can do IVR surveys up to 25 questions, the shorter the better. Typically, IVR surveys are around 12 questions long. The response rates of IVR surveys also vary from around 10% to 40%, depending on factors including the topic, length, country, and level of respondent awareness. There can also be issues with connectivity, which can lead to higher non-contact and drop-off. There's also a higher respondent burden in terms of the respondent needing to listen and enter numbers using the keypad of her phone. Long questions can also be challenging, although respondents can ask to repeat an option. So we usually do not want to include more than 5 response options. And although Likert scale is okay, completing scales and ranking can be challenging without a show card or interviewer. And finally, filling quotas to target specific demographics such as rural women, particularly in the case of national surveys and polls, can sometimes be challenging. One reason for this is typically access to mobile phones in developing countries is skewed towards urban populations and also towards male. Thus, when we use randomization as a research method, it tends to favor urban and male populations. To even the playing field, we often use a quota system to reserve some responses for hard to reach demographics such as rural women. Additionally, in patriarchal societies, where women are dependent on their husbands, some women are nervous receiving calls at certain hours of the day, especially if the voice is male, fearing that they could be accused of infidelity. Or women sometimes think that IVR calls cost them mobile money. To overcome these challenges, we often recommend mobilization and sensitization, including both women and their husbands, to build trust and increase response rates. Next slide. Overall, IVR surveys are designed to be delivered to populations who predominantly use analog simple phones or who have smartphones but maybe don't have access to mobile internet and data, who are illiterate or with low level of literacy and live in remote areas that may have poor mobile internet at times. As such, we ensure that IVR surveys are easy to understand and include as little technical language as possible, are short, simple, and concise and easy to remember, and are tailored to the target population at hand. This includes taking into account that women may not have a smartphone or may have a shared phone with their husbands and may not be fully aware of how to utilize a phone. They might be lower income or working in an informal economy, have lower literacy levels or live in remote areas, and might have different experiences or preferences than men. For instance, in terms of timing, in many countries, we found that women who have their own phone prefer picking up the phone in the early afternoon or early evening when their husbands and children are not at home. Whereas women who have shared phones often need to be reached when their husbands or fathers are present, usually early morning or late evening. Additionally, in this case, men in the family need to be included in any mobilization strategies and convinced that the content is for women and benefits the family as a whole. Women's voice and style preferences might also differ. For instance, in many countries, women prefer and are more comfortable listening to female voices. Change slide. Finally, I wanted to bring up a case study from 2019 when BIAMO, through Women Connect, leveraged our 321 service in Tanzania to tackle the digital gender divide between women and men. For context, the 321 service is a free-to-user, voice-based information service we offer in partnership with mobile network operators in 19 countries. Globally, as of April 2021, 65% of registered users on our 321 service are male. There are exceptions, like in Zambia, where 54% of registered users are female, and in Afghanistan and Indonesia, where there is almost a 50-50 split. In Tanzania, however, we have over 200,000 listeners per month, of which about 48% are women. For Women Connect specifically in Tanzania, the idea was to embed information about mobile internet and digital literacy into the content that women reported an interest in to tackle barriers to usage of mobile phones and internet. At the start of the project, BIAMO conducted a 9-question baseline IVR survey of 1,000 women to understand knowledge, attitudes, and practices of women in mobile technology, including digital information sources and barriers, as well as what information women and girl stakeholders want to have access to in Tanzania. Using that information, we then held a content creation workshop with female community representatives, our partners, relevant ministry counterparts, a gender specialist, and other key stakeholders to create 20 localized women-driven messages for the service around the main topics of interest discovered in the baseline. This included types of phones, being connected to the internet, safety and cybersecurity laws, financial literacy, and cost of data and battery life. These messages were then stylized and recorded by Biamo's local voice producer. In terms of style, a dialogue format was decided upon for most of the messages because we found that women in Tanzania tend to prefer an exchange of ideas versus a monologue. Some of the messages were between two women discussing a topic, and others were between men and women, for instance, a husband and a wife. The last part of the project was twofold. First, an online survey embedded on the 321 service collected feedback from Women Connect content listeners. Out of over 58,000 women listeners of Women Connect content, 74 reported that the information, reported that the information they accessed was relevant to them. Second was a boot camp with 20 mostly low literacy and low income women to raise their awareness about digital literacy and have them complete a pre and post survey after listening to a few Women Connect messages on 321. To wrap up, I wanted to share a quote from one of the women participants about how she benefited from the content, which you can read here. So she said, "I sell some fabrics and vintage, but I use my husband's phone to receive payments from my customers because I didn't have enough knowledge on how it works. And sometimes it becomes difficult to get my money on time because my husband is the one managing it. But from now on, I will be telling them to send the payment direct to my phone because I have understood how to use it and I will be getting my money on time and I will save it accordingly." Thank you so much for the opportunity to speak with you today, and I look forward to answering any questions you have later on in the session.
Thanks so much, Leah. It's really interesting to sort of see the contrast also between men and women. Love to hear more about that in our discussion, time permitting. Moving on to our last speaker, Neela Mitchell, who is the head of Kenya's 60 Decibels. Neela is a gender and international development specialist and has worked with social enterprises, corporates, social investors, and development agencies on inclusive business strategies and programs in several countries, including India, Bangladesh, the UK, and across sub-Saharan Africa. Neela leads the Kenya office at 60 Decibels, which is a tech-enabled social impact measurement and customer intelligence company, where she also leads its gender work, and she will be talking about lean data, issues and challenges in surveying women. So over to you, Neela.
Thank you so much, Sunita, for the introduction. So yes, today I'll be talking a bit about the methodological issues and challenges for surveying women within our lean data projects. Just to give you some context and a very brief background, at 60 Decibels, we conduct lean data studies, which are essentially designed to collect, analyze, and report on customer or beneficiary level impact and operational performance data. This quantitative and qualitative data is gathered on products and services, typically of social enterprises and companies that are operating in low and middle income countries in Africa, Asia, and Latin America, to help them understand who exactly they're reaching, their depth of impact as experienced by the customers themselves and described by the customers themselves, and their satisfaction with a product or service. We use live voice calls or phone surveys and a global network of research assistants, basically our enumerators, that carry out the surveys in the local dialects and languages. Our typical sample size is around 275 respondents, which generally gives us above 90 or 95% confidence level. And these respondents are usually the single registered customer for a product or service. We use questions that we've tested over the years for different areas that companies want to understand better about their product or service or impact. Our interviews typically take about 16 to 18 minutes on average, during which time we're able to ask about 35 to 40 questions. By asking these standard questions, we're able to do sort of comparative analysis and create benchmarks. The reason we decided on phone surveys as opposed to other types, which these make up about upwards of 80% of our work, is to reach people in a quick, cost-effective way, typically in remote areas, to get data back to organizations that they in turn can use to better understand their customer base and make decisions. We've also used SMS surveys at times, but it limits the number of questions we can ask. And in terms of gender reach, it's harder to get more qualitative data, of course, which further limits potentially reaching women and how much we hear from them. However, as you can see, despite having conducted live phone surveys for over 400 companies and through hundreds of projects, the percentage of respondents who are actually women is quite a bit lower than men. Among the 170,000 respondents we've surveyed by phone, less than 40% are women. This, of course, can vary depending on the country or sector in which we're working. Some of the reasons we've experienced these low response rates from women across our projects include that the registered customer is male, and when the company hands over their customer contact list, that is the information that we get. Of course, low mobile phone penetration in some cases in different countries, and low mobile phone ownership, privacy within the household, risk and fear of violence, and the appropriate times to speak due to domestic duties. Overall, we've not yet often done women-only surveys unless they're very customized. We do try to get perspectives from male and female customers or beneficiaries to get as complete a picture as possible. Next slide. Thank you. I'll go through a quick example of a lean data study we conducted for an off-grid energy company in the Democratic Republic of Congo. This was a company that wanted to understand the differentiated impact that its products, solar home systems and solar lanterns, were having on male and female customers. So in the study, we surveyed a total of 266 respondents, which included customers, so the main registered customer, as well as other users in the household, so of the 266 respondents, a total of 44% were women. This is both the customers and users. However, upwards of 90% of the responding group was in an urban area. And when we spoke to them, 97%, nearly all of them reported male family members as the head of the household, which in some cases contributed to the male being the registered customer within the company and then perhaps owning the phone. In this study, we were trying to gather data on customers and users' experience of the system, how it's impacted their day-to-day lives. And this included understanding whether it was a woman's first time accessing such a product, whether she had an alternative, and household dynamics around decision-making for purchase or budget or repayments. So we needed to speak to men and women. Now, our typical benchmark overall at 60 decibels for female respondents is around 39%. And in our energy work specifically, it's about 33%. And this often goes back to the registered customer more often than not being male. So for this particular company in DRC, which was installing solar home systems and distributing solar lanterns, the percentage of registered female customers was 28%, which was well less than our benchmark of around 39%. So we had to try a couple of different approaches to hear more equally from men and women. Next slide. So what did we do to increase the percentage of women we were hearing from? First was looking at the sampling frame. We decided that in order to have a representative selection of customers, but also speak to more women, to conduct interviews of not just the registered customer, but also the spouse or partner in the household. And given that 72% of the customers that we reached were male, we asked to speak to their spouse or partner. And in the majority of cases, a male customer was willing to pass the phone or have their spouse or partner be interviewed at another time. And this led to the data gathered from women to be 44% from the original 28%. The other thing we did to ensure a robust data set from the respondents we were talking to and to ensure completion of the survey was to make the second respondent survey shorter to collect only individual information. So we cut certain information that was about the household and asked more specific information around decision making. It was also a mix of open-ended qualitative and questions as well as Likert scale questions with options in order to quickly gather the relevant data from the respondent. Another approach was to adapt the consent form further for the second respondent, which was for women. Given that we were speaking to a larger number of female users, we ensured that they knew where we got their information from, that their spouse had said they were willing for us to conduct the interview, and to increase the chance for independent answers from the female respondent. Within the consent form, we also asked if there was a space they can go to speak freely. Finally, we tested this approach for first and second respondents through a pilot to ensure that it did help reach more women, and to also leverage our local research assistants to give us further context into the social norms or potential gender dynamics as we tested the survey questions. And then finally, stepping back a bit, again, out of this example, but more broadly, some of the things, oh, sorry, we can go to the next slide, actually.
Okay, thanks, great.
Some of the things we do to test or increase reach to women include matching female enumerators with female respondents. It's not a project-wide practice, but we're experimenting with it now to track the response rates and see if those increase for women. And then, as the case I presented showed, we also only speak to, more often than not, speak to one respondent, but we're also trying to get 2 respondents, again, to increase the number of women that we're hearing from. And then in terms of enumerator training, we do this anyway, of course, but for projects with more gender sensitive questions or probing questions, there is another layer of training. We're also looking into, in some cases, it depends on the company, leveraging women's groups to be able to coordinate speaking with more women. And finally, our SMS primers are sent out to give respondents a heads up that we'll be calling. In the example I presented on the off-grid energy company, this was done for the second respondent as well. So there was assurance both that their partner had provided the contact information and that we were a legitimate company, ensuring data would stay anonymous. Next slide. Of course, some of the limitations of our mobile phone approach in reaching women is that the customer contact lists are often male. So it does take a little bit more work to reach the intended respondent. Our phone interviews are typically single respondent. This is determined by the needs of the company and the scope of the project, so we can't always change that. And then similarly on this third point, it's kind of a snapshot of the respondent's perception at the time. And so without potential follow-up studies, we can't always know whether reaching women later in the project may have helped gather more or richer data. And then finally, not being able to really see what's going on at the other end of the line, of course, makes it difficult to always know if there is a risk to the female participant. So I'll sort of stop there and hand it back to you, Amnesty. Thank you.
Thanks. Sunita, just to flag, I know I saw a hand raise, and I would just encourage maybe to type questions you might have in the chat and we'll pick it up that way. Over to you, Sunita.
Perfect. Thanks so much, Amnesty. So I think we have about 8 minutes left, which really means maybe one rapid fire round of questions to each of the panelists. And I'm going to throw you a question and ask you to respond in like a minute. So we go back to the beginning to Divya. Divya, you highlighted a whole range of challenges associated with reaching women, starting with the digital divide and women not having access to phones in the first place, needing to pass through gatekeepers, etc. Given that there are all of these factors that prevent one from really reaching a reasonably representative sample of women, and with the prospect of perhaps returning to face-to-face surveys soon and being able to sort of mix and match methods more, I'm wondering what is maybe one of the key takeaways that you have from this work around, situations in which, yes, it's worth investing in a phone survey, or, in a setting in which perhaps, where access to phones is really less than a certain percent, or there's other kinds of challenges operating, it's really not going to be worth pursuing the phone survey approach. So just, what are some of those key lessons that you're taking with you?
Yeah, that's a great question, Sunita. Thanks. So in my mind, phone surveys have been invaluable, in the current context. And I think it's useful when you already know the respondent or the respondent knows you. So I think, that was the situation in most cases for us. And I think that really worked. And also if the questions are for the household. So, if you're kind of asking a woman a question about the household or a man, I think women, as I said, the kinds of questions should determine who your target is. And then you have these ways of targeting male and females. And, all of us have lessons in terms of targeting them. But if you have more sensitive questions, if you really want, to kind of build a rapport with someone new, I think you will have to go in person. And I think, so kind of more generic questions and if you've already, been in touch.
Great, thanks so much, Divya. Moving to you, Karima and Priya. You brought up this issue of the importance of rapport building, actually the need to take more time in the context of a phone survey to really, assure that the conditions are appropriate for the kinds of questions you're exploring to build rapport, etc. I'm wondering, and you also mentioned the need to sort of feed some of this information back to ethics review committees who may be constraining researchers' ability to engage in more extensive phone surveys. I'm wondering what has been the response of your respondents, of the women themselves? I mean, to what extent were women and providers, in your case, willing and open to engaging in longer interviews on the phone? What influenced that? Because, it's one thing to sort of put in place constraints from an IRB perspective. It's another thing in terms of what the communities of respondents are really willing to consent to doing.
Thank you, Sunita. That's a really good question. I'll answer I'll answer our findings from the sort of provider interviews, and Priya might want to pick up her experience from the women's community survey. But we found that if you call providers and they were very busy, they might say like, no, we can't talk now at all, or they wouldn't talk at all. And then you would get providers who are also very busy who might give you, a short interview. But we also found providers who actually wanted to talk a lot and talk for a long period of time, like up to 30, 40 minutes, sometimes 45 minutes. And some providers actually say, call me again because I haven't finished, but I'm busy now. And if you call me again, we can talk some more. So you would get actually 2 or sometimes 3 long phone calls of 40 minutes each. So it varied, but some people were very, very willing to speak for extended periods of time. And I think one of the things that I know Priya shared from the Community Women's Survey is that the women would sort of drive the conversation. And so women were more comfortable and asked more questions and sought reassurance and building a sort of rapport with the interviewer, which led to the interview actually taking a longer time. So I think that IRB panels, perhaps the restrictions on the very short length of time that telephone interviews need to stick to, is sort of a thing possibly of the past when not so much data collection was being done remotely as it is now. And I think IRB panels, need to catch up a little bit with that perhaps, and rethink the time limits on phone interviews. I mean, of course, we all try to take as little as possible of people's time, but if the respondent is engaged and wants to stay on the phone, then that should be there should be allowances for that.
Yeah, thanks, Karima. I think it's a question of who's really in the driver's seat. Moving to BBC Media Action, Arjun and Leah, I'm curious, you both used IVR, and I'm wondering whether you've compared and contrasted, IVR experience and response with face-to-face interactions. Again, as we're sort of moving into a situation in which we will have greater flexibility in how we draw on these different methods. Are there insights around, when IVR really works and when face-to-face might be a better
Sorry,
option?
Sunita, just before they answer, Arjun did the CADI survey for the human-centered design. So I'm just gonna maybe direct your question to our colleagues from Viamo, Leah, and 60 Decibels who
Perfect.
did
I got the
apologies. Continue, please.
Thank you. Yes, I got the two words wrong. I'll come back to you, Arjun.
Sure. So I think I had touched upon this in terms of the trade-offs between, IVR and CADI and face-to-face, in one of my slides. But I don't think we've done, a study on that. But, I think that especially in the context of COVID, when face-to-face is, not accessible, or there's limited accessibility of kind of face-to-face interactions, I think it's a great opportunity to use interactive voice response surveys. I think, when it comes to, as I mentioned, longer questions, longer surveys that are, up to 25 questions or more, I think face-to-face probably is, or CADI is better used in that case. But again, in the context of COVID, maybe it makes sense to try and cut the number of questions and do a shorter survey or multiple rounds of shorter surveys to kind of, deal with the context that we're in and use IVR, because it's better. Typically, IVR surveys are best when they're, between 10 and 12 questions long or shorter. And so I would say that, we could also, with kind of longer questions, ask people can ask to repeat options. So I think that, yeah, that would be kind of my response to that question.
Fabulous. Thanks so much. One issue that's been on my mind, I've been wanting to ask all of you, but let me direct it to Arjun. Is, to large extent, these surveys can be perceived as being extractive. In your case, Arjun, you were using the information that you were gathering from the respondents to sort of develop and design these platforms. And so was that Connect something that you think promoted participation? Can you comment on the perceptions of the population that you were working with?
I'm sorry, I wasn't very clear on your question. Could you repeat it?
Yeah, so the question was, given that in your case, you weren't doing research for the sake of sort of understanding the state of a population, but you're really gathering data to feed back into the design of these interventions, the platform, the learning platform. I was wondering whether you think that influenced the nature of the participation that you obtained from the population, and what does that mean that the group that you're working with may be more amenable to participating in future CADI surveys?
So this is actually something that we've thought about a lot as well. When we did implement, we have a lot of experience implementing IVR interventions over the last decade or so in India, and just the ability of who can actually interact with IVR changes very widely across different demographics. So just in terms of the like how amenable respondents are, or whether they're excited about IVR, when we actually started off with our interviews, and I'm going to speak mainly about qualitative research because that I think has been the most valuable experience for us. What we actually were doing was speaking to respondents to understand what their problems and what their issues were. And we did explain to them and build rapport that, this is so that we can build something for you, so that we can take this information and we can teach other women farmers like you. So I would say that there is definitely some degree of motivation among respondents, and we did definitely frame it as this is being done for other women farmers like you. You also have to keep in mind that when we speak about SHG federations in particular, There are already very strong social bonds that exist within federations, within groups, and women in SHG federations have a higher affinity for helping each other out. It's a very different context from if we were to cold call a number randomly, definitely.
But sorry, Arjun, can I just follow up on that? So I know you've also done, IVR surveys and other types of surveys for the purposes of data collection for monitoring programs. So how do your response rates and does your strategy, how does it differ if you're doing it for, as Dr. Sunita is saying, to gather information versus, to gather information for research purposes versus for designing a solution? Do you find that you have differences in the response rates?
I would say that we don't really experience differences in response rates based on the purpose of the research, but there are, of course, a lot of differences in how we design the research. Design research, of course, allows us a lot more flexibility than traditional, research for the purpose of research requires a lot more robustness, whereas research for the purpose of design and as part of a human-centered design process allows it to be a lot more participatory and in conversation with the responses that we're getting from respondents.
Great. I think we've really been feasting on a lot of very rich information, a range of situations and contexts in which we might be using our phone survey methodology specifically to reach and respond to women's needs. And clearly there's a lot more that we can unpack here. Back to you, Amnesty. I think you were going to.
Yeah, sorry, I'm just realizing. Yeah, we could have just had, we didn't have time for kind of the richness of the discussion, but thank you to all of our panelists for such thoughtful presentations, and Sunita for taking us through it and spearheading our discussion today. So we're really, really grateful. For those of you that are sort of interested in continuing the discussion, please feel free to sort of reach out to my colleagues here. I think you can find most of them on LinkedIn, or reach out to us if there's a burning question that we didn't get to answer today, and we'll try to come back to you with it. And just a sort of a little closing plug here. So Dr. Sunita, myself, Sarah, and others are engaged in editing a special supplement that released the first tranche of papers in the British Medical Journal Global Health. It's a special supplement on digital innovations for community and primary healthcare in India. There's a sub-theme that Dr. Sunita is co-editing with myself and some others on methodological innovations with an emphasis of remote data capture. And a number of our speakers from today have articles that are presented within this. So I encourage you to go there. The link is on the chat as well. I think one of my colleagues from UNU is going to paste it there. So please, if you want more information, a lot of these papers may sort of satiate that appetite. And just sort of one closing sort of thought from one of these papers, there's sort of 5 questions to consider, which is your research needed? Can you reach the target population? Is this really the right modality, i.e. to collect data through the phone? And I thought Divya really answered Sunita's question in that regard very nicely. And then of course, as Karima talked us through, is really around the risk to respondents. And then of course, meeting the policy needs of key stakeholders. So without further ado, we thank you for your time today and look forward to seeing you at our subsequent webinars. Thanks again.
Thank you. Bye-bye.
Bye.
Thank you. Bye-bye.
Thank you.
Bye. Thanks.